Hello everyone and welcome back to eMedQuest. Today we are discussing about hemoptysis from Rosen's chapter, covering key concepts, pathophysiology, diagnostic approach, and emergency management. A key concept about hemoptysis is its definition itself. What is hemoptysis? So it's basically the expectoration of blood that comes from the respiratory tract. If it comes from the GI tract, it's hematemesis. This blood can either be coughed up or it can come in large amounts, and that is why it is important to differentiate between massive and regular hemoptysis. Massive hemoptysis is basically someone having blood come out more than 100 mils per hour or more than 500 mils in 24 hours. And hence, hemoptysis can be divided into minor and major. Major or massive goes together. So, the cause for minor hemoptysis is usually the tracheobronchial capillaries, but for major or massive, it is usually bronchial or pulmonary arteries. Some of the causes of hemoptysis in general is inflammation, malignancy, vascular malformations, trauma. Remember that the most or one of the most common cause of massive hemoptysis is actually bronchiectasis. So, how do we approach somebody who is coming in the ED with the complaints of hemoptysis? First thing that we have to do is to make sure that it is hemoptysis, the source of the blood is pulmonary and not GI. This can be aided with a very clear history taking regarding the volume, color, frequency, and the exacerbating factor. Second is to look for the pivotal findings. So, if they have bright red or pink frothy blood, it suggests that it is coming from the pulmonary system. Do they have associated cough or not? Do they have risk factors? Do they have TB or some form of malignancy or some sort of a chronic disease in their lungs? Third is we will do appropriate resuscitation and stabilization if they're having massive hemoptysis, and we will discuss that more in the management. But let's say that we have stabilized our patient. The next thing in line is to get an imaging. Chest x-ray is a good place to start because it can help us look for etiology, but it can play a limited role because it does not really tell where the blood is coming from. For that matter, high resolution CT is the first line imaging because it will help us locate the bleed and it will guide the further intervention. We have another imaging modality called bronchoscopy. Now, this is both diagnostic and it is therapeutic intervention. And sometimes, if the CT is not very clear, then we do turn to bronchoscopy to delineate where the bleeding is coming from. And then obviously we have angiography, but generally it gets reserved for those cases that end up needing embolization. So, what is our emergency management? There's a very good chart that is mentioned in Rosen's that I will draw over here. So, first thing is, does the patient have trace blood or do they have history of any viral bronchitis? If the answer to that is yes, then they can safely be discharged home with some sort of a follow-up in place. If the answer to that is no, then we have to send in some basic labs. So we have to send in CBC, we can send PT-INR to see if it is warfarin induced or DIC induced hemoptysis. We can put chest x-ray, we can type and cross the patient in case the patient has massive hemoptysis and needs blood. Once that's done, we ask ourselves, is the chest x-ray giving us some sort of an answer? Does the patient have a malignancy? Does the patient have TB? Some chest findings that point towards what could be a potential source of the bleed. If the answer to that is yes, we get oncology or we get pulmonology on board as needed. If the answer to that is no, then we go ahead and get chest CT, high resolution CT with contrast. Then we ask ourselves again, was that diagnostic or not? If the answer is no, then we have to call pulmonology to do an urgent bronchoscopy. If the answer to that is yes, then once again, based on whatever is the etiology, we give a call to oncology and pulmonology. But this was the disposition or overall management pathway. If we talk about the specifics, particularly if we talk about massive hemorrhage, first, as it is with any emergency case, we look forward to managing our ABCs first and we intubate as needed. There's a caveat over here when we are intubating patients with hemoptysis, and that is to generally go for a larger size of ET tube because a smaller size can easily be blocked by clotted blood. So, generally, a size 8 and above it is what is recommended. Third is we will use some form of imaging to look and locate the source of the bleed. If the bleeding is not being able to controlled by bronchoscopy, then we will call IR for embolization, and this is usually the first line for any life-threatening hemoptysis. The medications that we generally use is if the patient has warfarin induced bleed, then we should consider using FFP or vitamin K. If the patient is having low platelet count, then we transfuse them with platelet, and if they have massive ongoing bleed, then TXA should be considered. And finally, these patients who come with massive hemoptysis need to be admitted to the ICU. Some more caveats in this. There's a particular complication of a patient who has a recent tracheostomy. Even if they had the tracheostomy a month back and they come with massive hemoptysis, we should consider tracheoinnominate fistula, in which case there are two things that we can really do. We can either overinflate the cuff of the tube, or we remove the cuff, put our finger in and apply digital pressure with the hope of stopping the bleed. But in itself, this fistula can be disastrous for these patients and should be taken very seriously. Another thing is that if we are thinking that the source of bleed is in the lung, so we should be placing the patient bleeding lung down position. So, for example, if they've got a bleeder in their right lung, then we should make them lie on their right side, compressing the lung and hopefully stopping the bleed. This brings us to the end of today's video. It was just a very general overview about hemoptysis. If you found it useful, make sure to like, share and subscribe to the channel for more such content.